Okay, hello everyone. Um, yeah, thank you so much for joining today's webinar. We really appreciate your time to join us to talk about biomedical waste management. Basically we are the umbrella in which we are running this webinar is of Bliss Foundation. And it's a foundation that is based in Cameroon. So we are trying to promote waste management, not only in Cameroon, but in other countries and other developing countries, especially, and of course across the globe. So that is why we organize such webinars to talk about waste management problems. So we are not we don't only talk about biomedical waste, but all types of waste. If you've been joining us in our previous webinars, you see we talk about food waste, and today we are talking about biomedical waste. So in our subsequent webinars, we look forward to talking about other waste. So thank you so much for joining us today. And we are very happy and grateful to have our two speakers today. And the first is Miss Ashima Jha. She's joining us from India. She'll be telling us about the biomedical waste situation there, which is really, really very important. And then the second speaker is Mr. or Dr. Mr. Ache Valerie, who is joining us from Cameroon, and he will be telling us about the biomedical waste situation in Cameroon. We believe that these two countries they stand as icons, especially in developing countries, and we could learn a lot from them. And the models could be applied, of course, not only in other developing countries, but also in advanced countries. So it's an opportunity for us all to learn about what is happening with medical waste, how it is treated in other countries. And of course, others who are joining us today will share, their knowledge on biomedical waste management, of course, in other countries or other researches. So we are open to talks about this particular issue because we want to promote it. And growing up as a researcher on waste management, I realized biomedical waste, I think, has been given less attention. And this type of waste, I believe, talks on this type of waste has been promoted or has been up recently because of the COVID pandemic. So I believe it is an eye opener for us all to look at this type of waste, which really, really affects our health, because we go to the hospitals to get treated, but of course, still from the hospitals, waste is generated. So what do we do? How do we manage such waste? It is very, very important, because we shouldn't go to treat ourselves and then we rather we generate waste, and we don't properly manage this waste. It will make us to be sick the more. So it's like treating ourselves and then going back to consuming or to exposing ourselves to to the processes through which we got treated. So it doesn't really help us to recover from the situation. And of course, our environment is deteriorating. So there is a need to look into such waste, biomedical waste. And of course, and I also believe that medical practitioners, should be urged, to have more concern on this type of waste. Yes, because growing up, or from the community in which I came from in Cameroon, verily I didn't find any forum or any avenue in which biomedical waste was being like the message or the knowledge was being spread, or talks about this type of waste. So I believe it's a good opportunity. And those of us who are joining us on Facebook, and since we are live streaming us on Facebook, please just drop your comments in the chat box or in the comment section. Yes, and let us know. And for joining us, you could let us know which country you're joining us from. We appreciate your participation, and we look forward to a successful webinar, a successful event. And of course, at the end of each presentation, there will be question and answer session. So feel free to give any questions you have or comments on the presentation, or any contribution that you have with regards to biomedical waste management. So thank you all so much. And yes, so let's look forward to listening to our speakers. Yes, so basically, yes, or without further ado, I think we will proceed with our first speaker for the day, and that is no other person than Miss Ashima, who is joining us all the way from India. So she will tell us about herself and, of course, give her presentation. So over to you, Miss Ashima.
Thank you so much, Miss Solange. It was amazing to be a part of this discussion. I'm sharing my screen. Just let me know when it is visible.
Okay, not yet.
Just let me know if the screen is visible.
Yes, it's visible.
All right, pleasant greetings, ladies and gentlemen. This is Ashima Jha from India. I am an international public speaker, and apart from that, I am also a fellowship from the government of India. So I'll be talking about certain key considerations in biomedical waste. What is it? I'm pursuing my graduation in waste as well. So I'll be talking about how we can tackle it at our homes as well, and it is impacting the environment as a whole. So without further ado, what is biomedical waste? The basic definition of a biomedical waste is any solid or liquid waste, including its I'm so sorry. I think my internet was facing some issues. I hope it is visible again.
Yeah, you could try sharing your screen again.
Just let me know with a thumbs up if it is visible.
Okay, not yet.
Okay, let me just try once more.
Okay.
Is it visible now?
Yes.
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 Okay. So biomedical waste means any solid or liquid waste, including its container or any intermediate product which is generated during the diagnosis, treatment or immunization of human beings or animals, or any medical research activity. The basic identification of these kind of waste is that it comes from a medical stream and they have a potential to create infections. And that is why there is a special category of biomedical waste. If it is not managed properly, its exposure to the environment and the people managing it may be problematic. So in the figures, if you can see here, there are certain examples of biomedical waste. This is a very basic structure, very basic color coding system followed in most of the hospitals, even in India and outside India, about managing different types of waste. So yellow is for all the anatomical waste, all the body organs, expired medications, body fluids. Then red comes for the contaminated plastic bags, specifically all the plastics, all the contaminated plastics. The white one is for the scalpels, blades, needles, all the syringes, everything which can inflict a direct harm. And the blue one comes from the broken glassware, cytotoxic waste, body implant, So these are certain color coding systems which are given in hospitals for the people who are managing the waste in hospital to follow this. However, our biggest concern is that due to the COVID-19 pandemic, when there was glush of patients in the hospitals, managing this colored coding system and following it appropriately in especially developing countries, majorly the African countries and countries like India, Bangladesh, Sri Lanka, which are developing, which were already facing a crisis. So this management was a big challenge. So what are the major effects of improper management of this waste? So it does not only impact us humans, but it also causes environmental problems. It causes air pollution. So there are a lot of waste which just thrown in landfills, lot of medical waste. They can be potential to spores or pathogens in the air. So if they're breathed, they create problem. Waste without pre-treatment, if transported outside the institution or if dumped in open areas, very common sight seen in most of the developing countries, open dumping, land dumping is very popular in order to get rid of the waste. And that is how these pathogens can enter the atmosphere and impact the environment and human as a whole. Then chemical pollutants, most of the waste also constitute of different chemicals, different treatments for cancer patients or different medicines. So all these chemical pollutions also create problem. And if you all will agree to this fact that in most of the countries, most of the developing countries, we have the system of open burning or incineration, because we cannot afford a lot of good systems or good instrumentations. Open burning and incineration is there, and that creates air pollution. How it impacts the land is again a very simple analysis. Things go into land, they are leached out in the soil, and they affect the crop, they impact the food chain, and it is overall creating a domino effect. It's not just impacting humans, but also animals, also surroundings, also the food we grow. So this is a big problem, as introduced by Ms. Solange in the introduction itself, and that needs to be addressed and managed in a very careful manner. Now coming to this fact, how COVID-19 exhibited this concern. So this problem of biomedical waste management was earlier only restricted to hospitals. So this problem was in hospitals, but after COVID-19, when all of us were asked to wear masks, the disposable mask, so it also started generating from households on daily basis, the blue mask, the white mask, the disposable ones. After 6 hours, you are supposed to throw them. And without segregation at the source, these went into the hands of lot of rag pickers and informal sanitation workers who are not trained in managing this medical waste. So it is directly impacting their health and creating havoc in the surroundings as a whole. If you just see this diagram on the very top left of the slide, you can see impact on marine environment. So it is a very good domino effect which can be explained. Waste is dumped into the ground, the medical waste. It is absorbed by the soil and groundwater. It contaminates the food and water. It also kills the marine life and fishes, a direct impact. And these dead bodies, they start floating on the water surface. And after they float on the water surface, mosquitoes start feeding on it, creating situations of malaria and things like that to the entire community. So just imagine a small careless mistake, a small difficulty of not segregating this waste as source, how it is impacting a bigger environment. Now coming to the human damage. Now there are a lot of children in countries who live there near these landfills, big landfills. There are a lot of children also who are living, and their body responds to these materials in a different manner, impacting our youth, impacting our surroundings. Skin diseases, problems of rats, insect and pest is very prominent. Tuberculosis, pneumonia. My colleague, who's the another speaker, would also be agreeing to this fact that the diseases like tuberculosis, pneumonia, diarrheal diseases are very common in people who are into managing such waste. Apart from this, there is also an aspect of occupational health concerns. So people, not only the informal sector, but also the formal laundry workers or the nurses or the emergency medical personnel who are into managing this waste, But if there is lot of quantity coming, how can they manage with small workforce? So this is our major target problems. And now my audience would be wondering, oh my God, this is a big problem. How we are going to manage it? So again, it also impacts the environment and leads to climate change as a whole. So this is how I have tried to establish a link, how one waste stream is impacting everything in a very broad manner. What can be done? That is a big question for today, which all my audience would be wondering, oh my God, she's just scaring me. This also happens. This also happens. I just threw that mask in the dustbin yesterday and this can happen. So let's see how we can manage it. First and foremost, there is a need to change the attitude and behavior of the people in terms of waste management, not just the medical waste, but any kind of waste. Whenever a waste is thrown at home, there should be a source. The dry waste should be treated differently. The wet waste should be treated differently. Then it can avoid a landfill situation. As such, we can simply recycle lot of materials, and we can also utilize lot of waste which are going into incinerators and to energy plants. So in India, many researchers are working on this, how to create energy from waste, how to run vehicles from this burnt waste energy or the methane which is produced from these waste. Recycling and zero habits take time, but every individual action matters, and that is what we need to focus. We need to aware people at the very base of the society. There are certain small steps which can be taken, which most of us know from school days. We are taught in our schools, most of people are taught that, you should choose paper things, you should not choose plastic, or you should not directly go for disposable, but carry or your own baggage when you are going out. A very simple thing which I just want to emphasize here is that a butterfly fluttering its wings 900 miles away from you can cause a hurricane right where you live. This clearly means if one nation is creating a problem, or if one small environment is in problem, it is impacting the whole geographical area. And that is what needs to be fostered in the minds of the youth and the young adults of the society to take charge of. So there were certain critical analysis as a part of my college projects and part of my research projects, which I have been doing. So there is a need to understand few things. So there are a lot of international laws on managing biomedical waste globally, 168 national laws and 111 international laws. So if we compare these laws, so, there is a clear-cut difference in how waste is managed in developing countries versus the developed countries. In developed countries, we see that the more priority is given in segregating waste at source. However, in developing countries, what we are doing is we are just collecting waste. If waste is coming, okay, just collect it. Waste is coming, collect it. We are not focusing on its segregation at source. If everything just collects and we are not segregating it, it is creating problem. But what developed countries are doing, they're segregating in the simultaneously when they're collecting the waste. So that is one thing that we need to do in the developing countries as well. Moreover, most of the persons involved in this process is unskilled. Most of the people who are managing biomedical waste are unskilled, are informal daily wage workers, because there is a lot of people who are into this for the sake of getting daily income. They are into it, but they're not given proper masks or proper protective gears when they're managing with this waste, or they're not also trained about how you're going to deal with it, or in what manner, in what particular dustbin you are going to dispose this. So that education and awareness needs to be put from a community level to these people. If we focus on the management of waste after it has been collected, most of the countries like India, Bangladesh, Indonesia, Malaysia, Sri Lanka, Thailand, even the African countries, most of the common thing happening is incineration. Everything is going into burning. Everything is being incinerated, which is creating big problem. And this incineration is generally followed because it is cost effective. It does not cost more and it is easier to do. However, if we see the existing laws in the countries like Japan, South Africa, Mexico, Kenya, we can see that apart from incineration, what they're doing steam sterilization, that is autoclaving. They're doing shredding. They're disposing this waste through microwave. Apart from being solely dependent on incineration. So we need to do it in a very, very categorized manner. And if we start segregating our waste at the source, it is very easier for us to utilize different techniques apart from incineration. Thus, it is going to protect our environment as a whole. Now, I, as a part of my project with the government of India, started doing a lot of awareness campaigns and removing this fear from people's mind that even if it is Corona, we can recycle lots of things in order to prevent waste. So if you can just see these two posters, which I made as a part of my awareness campaign. So is single-use plastic really protecting us? Lot of times in COVID-19, everything has shifted to single-use plastics. Just use and throw stuff. And if you can see the another diagram towards the right of this slide, which talks about dying people, suffering earth, plastic pollution, all have led to enormous waste, and this disposed mask has enacted it past. But can we join hand to give it a decent restart? Now, with this thought, most of you would be wondering, so the mask which I threw yesterday in the dustbin, do I need to take it out, wash it and wear again? No, no, no. I am not suggesting that. But this blue mask, which is coming as a biomedical waste from our household, can be done, can be recycled in a very good manner, creating less waste. And how we can do it? Let's see. So this was my project, which focuses on collecting these disposed masks, which we generally throw in the dustbins. Just collect them and bleach them. Put them under bleach and then under direct sunlight for 72 hours. It has been proven by the medical research that any potential pathogen, even the coronavirus, cannot stay on mask surface after 72 hours. So it will eventually die. So you put it under direct sunlight for 72 hours. After it is done, you can simply convert them into containers by stapling their ends. Just stick their ends and they'll become small, small containers. Now, what I used to do with my family in, it was summer season and a lot of fruits used to come. So I collected mango and jackfruit seeds. Any fruit which was coming, we were collecting seeds. And after these seeds were collected, we just put soil in these masks and we started growing these seeds in small, small planters. Small planters started growing. And now I had small planters ready with trees. So what I did, whenever I used to go out to an open ground, I just simply took one planter, two planter and planted it here and there. So this was killing two birds with one stone. It was reducing this medical waste from our household, and it was also creating more greener spaces in our environment. And with this method, I'm very happy to share that about 30 plants have been planted with my family, my father and I. And that is one thing that we need to understand here, that we should never doubt that a small group of thoughtful, committed citizens can change the world, because it is the only thing that ever has. And with this program, I involved a lot of sanitary and community helpers also, and given them proper education about how you can manage with this waste which is coming from the household, which is medical in nature. That is the mask, that is the sanitary kits or the PPE kits, everything which is in medical category, which has potential power to spread COVID-19, how we can use it or how we can dispose it in a proper manner. So this was our way to connect with the community, to create green spaces and give them knowledge and understanding about how these things can be managed appropriately. In the end, I would just like to say two things to all my listeners, and thank you for the patient listening first. It has been very well said by our father of the nation, India, Mahatma Gandhi, that earth provides enough to satisfy every man's need, but not every man's greed. And that is what needs to be understood. We need to prove to the trees, we need to prove to the other organisms living in this environment that we are humans and we are also compassionate to them. So these small steps, these small projects needs to be fostered in a big level to create greater impacts. And that's all. Thank you so much for patient listening.
Oh, okay. Wow. Thank you so much, Ashimaja. That was an awesome presentation. That was so great. And the project you are carrying out, I mean, it's the first time I'm hearing this. This is so amazing. It's really, really amazing.
Thank you.
Yeah, so really,
Thank
really
you
good
so
job
much.
that, yeah, really, really great job that you are doing. Wow, that's awesome. Thank you so much for your awesome presentation. Yeah, so, yeah. All right, so now let's move on to Q&A. Q&A. Yeah, any questions? Any questions to Ms. Ashima regarding her presentation? Any questions or comments?
No, I'm really happy because I was really lost, but I've really learned something. In short, they are really too much for me. I've really learned a lot of things. I was just saying, wow, so this is how it was. So because we grew up in an environment that all these things we don't know. So yeah, we are really learning. I've really learned a lot. So I thank you very much. It's very, very interesting. Thank you once more again. I'm so happy. Thank you.
All right, thank you so much, Mrs. Awambeng, for your comments. That was really awesome. Thank you. And okay, I have some questions. Okay. Yes. Dr. Ache Valerie's hand is up. Yes. Could we hear from
I just
you?
want to appreciate Ms. Shama and to thank her for her presentation. It's not a question.
Okay. Okay, all right, thank you. Thank you for appreciating her. Thank you. Okay, while waiting for other questions, if any, I have a question. Okay, regarding the mask, right? You collect from various households, right? The mask, the face mask.
Sorry,
The face mask, you collect them
I
from
talked
various
about.
you collect them from various
Yes.
households,
So
right?
yes, so a lot of face masks. I involved my students. I involved my student friends and also a lot of family members into. I just simply told them, don't throw these masks. Just put them in a poly bag and give it to me. So I put them into bleach. I used gloves, and after putting them into bleach, I put that under sun for 72 hours, and then I got a lot of containers out of those masks. So I collected them from the households nearby.
Ah, okay, all right. That's great. Okay, because I wanted to ask about that, because the mask has been used. So, with the concerns regarding COVID concerns, how do you manage the mask, or how do you collect them, and and bleach them and sun dry them? So it's understood. If they put them in, in like in plastic bags, and then you use gloves, protective gloves, then yeah, okay. I think that is great. So I wanted to ask about that because your safety also is of utmost concern. And of course, those who are listening or those who are watching us should also understand, like if they want to carry out such a project, they should also take various precautions, so that their health is also ensured. So that is really, really lucrative.
Absolutely.
Yeah.
Absolutely.
Yeah, that's really, really awesome. Yeah, I think if we could, keep doing that, because I have experience of doing nursing plans in polythene bags, but this is the first time I'm hearing about masks. Of course, the issue of masks became so prominent, because of COVID-19. Back home, my parents used to nurse like palm trees. Do you know palm? We need to nurse them, and then for
Yes,
planting,
yes.
we used to do, we use polythene bags. So so it's good to learn another way of nursing plants, and that's really, really awesome. Yes. Okay, and then another question that I have is you know, you talked about waste segregation, right? Is very, very important. And developing countries are really not very not they are really not practicing that. We see that in advanced countries. For example, I am in Japan, and you know, they really segregate waste. And yeah. And the people are expected, like we buy the plastic bags that we separate the various types of waste, you know, because of course we are looking at the level of income here. People could afford, they could pay for such things. But in developing countries, that would be difficult, right? To ask people to buy these plastic bags to separate, you know, the various types of waste. So I don't know. I'm coming from Africa myself, and you are from India. I don't know. What do you think? Is there any progress in India with regards to waste segregation? Because I think it's a very difficult thing to introduce in developing countries. So is there any progress, you know, that's going on in India, or
Okay,
any ideas on
so
how we could actually approach this?
that is a really very practical concern, and in order to address this, now what happens in India, we got a lot of people in informal sectors, lot of people who are not in very good income sector, but they are involved in this waste management and collection. So there is a person who comes every day to our locality to collect waste from every household. So what I have done, and I, with the help of few community people, first I had to aware them about the side effects, and then I had a group, small group. So what I did, I talked to that person and told him, bring two big bins, and we will give you two different categories of waste. So instead of buying polythene and creating another huge amount of plastic waste, what we do is, it's simply in our home, the garbage bin, we have two garbage bins, one bin, and the person who comes to collect that waste, we ask him, you also bring two bins, and you collect the waste in different bins. So this is how the waste is being segregated at source. We are actually focusing on awareing the person who is collecting this waste from different sectors, from different households, to be aware first. Because if he is aware, he will be able to do it in a much proper manner, and then it is easier to send it for recycling. So we are focusing on awareing the person who is directly collecting the waste from the houses. So even if the houses are not able to segregate, at least he has got two bins and he segregates himself. That is what we are trying to do.
I see. I see. But don't you think that will be difficult? It will be like too if the house the masses don't segregate waste, right? It'll be like too cumbersome for the waste collector to do the segregation. Don't you think? Because I believe it's like a communal effort. Everyone has to put in their effort for this to actually work, you know. So and also like for giving like the waste bins to households. Yeah. So how
Yeah, I'm back.
is it for each household? Is it for each household, or yeah, or how do you do, or for how many households? So how big is the waste bin? Yeah, something like that.
Okay, so what we are generally doing is, it is not just one person doing things, and in most of the developing countries we got a lot of people doing these work. So what we do is we involve the local community leaders of the community, the person who are into this maintenance and who are in charge of the entire cleanliness and entire maintenance of the society. We involve those people, so they become the leaders, and then we got people who are collecting waste. See, our job is to aware people to segregate waste. So most of them are doing it also by setting examples, by giving them directions. But even if some household is not doing that, we actually so we take small localities. Small locality, I live in New Delhi, and New Delhi is divided into many small localities. So around me, 4 or 5 localities. What we do is we just simply target one locality. So when our project becomes bigger, it becomes aware to the community leaders. We automatically present this project to the bigger leader of the community, the bigger minister of the community, and that way this becomes a law. that, this can be done and this person has to do this. And if it is not done, we can impose charges and fines, because that is how developed countries plan is in progress. They impose a lot of charges and fines if things are not done properly. So just for the sake of that fear in mind that no, I have to do this in order to follow this law, we can do this as well. But right now my program is in a very small community level and I'm trying to make it bigger as well. So I have tried to influence 4 or 5 people who collect waste from our locality, and they're into segregating it at sources. And apart from that, we are also involving a lot of science community into discussing this, how to segregate and how to aware them, because we have got big population. And in order to make it impactful in a bigger society, we need science help as well. So we are working on it gradually, and we'll be soon coming up with more concrete solutions.
Wow. Wow, that's great. That's really, really awesome. That's good. I think that's the situation there in India, I think, is a little bit different from Cameroon, because we have a main collector. The company is called Hizakam. So they go around with their trucks and they collect garbage. Like in Japan, what they do is they have special days. They've assigned days for the collection of particular waste. For example, Mondays could be to collect plastic waste, and Tuesday, food waste and things like that. So whenever the collector is coming, you know the day. If it's Monday, then you know it's plastic waste, like that. So basically in Cameroon, we don't have we just have the one main collector, the Hizakam. So yeah, so I think it's yeah, of course, like you're saying, it all involves everyone to play. And of course, you need the law. We need law, to enforce the people to respect that. We need something that will push them, because some people, even if you tell them, like, this is important for us to segregate waste so that we could easily recycle, some people won't even do that. Even if you provide them the garbage bins, they will still come. If you say, here, just put in cans, they'll come and put in food waste. Some people would still do that. So we need the rule of law to push people, and of course to levy fines. If you don't obey the rules, then you're fined. That will make you to obey the rules so that you avoid such situations.
And one more thing we can do in order to make it more socially acceptable and to change the attitude and behavior of the people, what we in my college, what we do, we have a lot of days. So we have one day dedicated to waste management. So in all the students in the college are engaged into cleanliness, community cleanliness drives. So they go and they do small street plays and they aware local people. This is one thing we do. Other thing, we have a lot of activities. So they have to do this poster making, slogan writing, and then presenting it to the community, and then they are given awards if they do it well. So this is how we are involving all the youth and students into this, so that awareness is at its peak. And when we are able to successfully bring this into the notice of the bigger authorities, then of course a law can be made and can be implemented. Because situation in India is not like, you have 5 different transports to collect 5 different types of waste. It is not like that in India. It's just one person who comes and collects from households. And if he is aware, if he is educated, other things can be managed very nicely.
Okay, that's good. That's awesome. And I believe in India, you also have various recycling companies, right? Because if we collect this waste and then there are no recyclers, what next? We still go and dump them together. So it doesn't make sense. So we also need recyclers to be able to recycle the various types of waste. So how is the situation in India? Do you have many recyclers of various waste in India?
We have been successful in a lot of scientific exposures on this. So what we do is we collect a lot of plastic waste and we melt it and we use them to lay roads. So there is this polyblend technology in India. Apart from that, there are a lot of waste which is used in making cement and building materials. So all those are burned and used in that way. Apart from that, all the plastic waste bottles are collected, they are filled with mud and used as building blocks or building bricks. for households. However, these small projects are not in a very large scale, and that is what we are focusing right now as the youth and as the Waste to Wealth initiative, that all these interesting projects which are actually workable to be implemented in a bigger picture. So that is what we are focusing on. But a lot of recycling stuff is coming, a lot of recycling plants have been set. But again, I told you that incineration is the only thing people follow. So
Yeah,
our focus is to shift into different compartments of managing that waste.
I see. Okay. All right. So I believe also incineration is the major method that is used to recycle biomedical waste in India, right? I think so. Is that right?
Not
Incineration.
just in India, not just in India, actually, it's all the developing countries, I would rather say. Because from my research, incineration and open burning actually is there like everywhere in order to get rid of the waste. So we in India are focusing on using that energy into something else. So, using it into making cement or making bricks or making roads, that energy can be utilized. So that is what we are working on.
Okay. All right. Well, that's understood. That's good. That's good. Yeah, what I was talking about the incineration of biomedical, like you said, is I believe it's common in most developing countries. They just burn everything together, and of course they don't really have like advanced equipment that will not permit emissions. So it's the incineration with the type of incineration they do is there's still emissions, which is not environmentally friendly. So I think there's need for improvement on that. So yeah, so I think that situation is similar in Cameroon. Wow, thank you so much, Ashimaja. Is there any other question? Any other questions? We have Justice Law, who is joining us now. I don't know if you're able to pick some parts of the presentation or the discussion that is going on. Yes, so any other questions? Okay, I think if none, we'll move on to the next presentation. I believe at the end we'll have discussions on both presentations. So, so thank you so much, Ms. Ashimaja. It was really a nice presentation and discussion. Yeah, thank you so much. And it was really wonderful to learn about the situation in India. And that's what I was asking, like comparing it with that of Cameroon and of course, Japan, where I presently reside. So thank you so much for sharing about the situation there and your wonderful project that you're carrying on. It's really awesome. Thank you so much. All right, so now let's move on to our next speaker, and that is no other person than Dr. Mr. Archie Valerie. Yes, so maybe you could begin by introducing yourself and then listen to your presentation. So is it okay if I share my screen at once, or would you want to introduce yourself? Okay, your mic is mute, please. Could you unmute your microphone?
Yeah, greetings everyone. Good morning.
Good evening or good afternoon.
Well, in Cameroon here we are about 12:52, so it's actually afternoon.
Yeah.
I'm Ache Valerie. I am a 70-year medical student at the Faculty of Health Sciences, University of Bamenda.
Wow.
It's wonderful on this platform, and I don't have much to talk. My colleague, Mrs. Ashima, has already spoken a lot, so I will just say some things that she has not said. I was really impressed with her presentation, especially when she was talking on the hazards, because it is practically the problem of developing countries like our country, Cameroon. So I'll go straight forward to share my slides. So we'll have an itinerary, we'll do an introduction, then we'll see the different types of biomedical waste, the different methods of biomedical waste management, we'll equally see the situation in Cameroon, then we'll have a conclusion, then questions and discussions. As we all know, Cameroon is often called Africa in miniature. It's located in Central Africa. As of now, our population is approximately 27 million, with a life expectancy of 59 years. As you can see, we have about 4 general hospitals, 4 central hospitals, about 11 regional hospitals, 164 district hospitals, 155 area medical centers, over 1,888 health centers, but 1,600 are actually operational. So the country is small, but there are quite a number of health facilities. Okay, so when we talk about biomedical waste, we're talking about any unwanted materials that are generated during, whether it's medical diagnosis, during the treatment and operation, or during vaccination, immunization, or during research work, including production of biologicals. It includes materials that we use while administering treatment to patients, as well as items that are contaminated, hazardous fluids, for example, blood, urine, feces, and all this. These are materials that they look very simple, but they can really be a problem, especially to human health. Please, okay. So when we talk about biomedical waste management, we are talking about all those measures that we have put in place, either at the local or national level, to make sure that these materials are well taken care of and that they are not a problem to health workers, veterinary staff, researchers, sanitary workers, and others whose lives can be put in danger. We're talking about materials that we use while administering treatment to patients, all these fluid, blood, urine, feces, and other body fluids. And these measures usually are adopted at national level. And in our country, Cameroon, this is usually done by the Ministry of Public Health. They are implemented at the level of healthcare facilities. For Cameroon, for example, we have health centers, we have private health facilities, we have district hospitals, regional teaching and reference hospitals. So all the measures that we are putting in place to make sure that all this waste, whether it's as a result of a diagnosis, treatment, after a surgery, whatever has been done at hospital level or in a research lab, to make sure that these things don't become toxic to human health, we are going to coin it medical waste management. So there is no unique classification particularly of biomedical waste, but there are some things that have been shown to be common to all. There are different types we cannot really say because others have a mixture. When you want to take a classification, different countries have a way of presenting it according to how advanced they are in technology. But generally, for this presentation, we are going to group it into 6 categories. The first category is human anatomic waste. As you can see, things like tissue paper, body parts that can come from maybe an amputation or after delivery. You have placentas from newborn babies. You have nerves that fall off, organs and other things. All this will fall under human anatomic waste. The second category of biomedical waste, just for the purpose of understanding, is what we call animal waste. They are usually generated from research work and from activities in veterinary hospitals. Cameroon is one of those countries in Africa that a veterinary sector is quite open and developed. We have a training school even in Ngaoundéré there that trains veterinary doctors. And we equally have a mini training school here, West region of Cameroon at Jakiri. So many of these wastes are generated here. Things like drugs, waste feed, dairy manure, poultry litter, and others from goats, activities of cows, and so on. So we put them all under animal waste. The third class of biomedical waste that we will see is microbiology and biotechnology waste, or we can also call it infectious waste. They usually come as a result of laboratory investigations and research work and remains a waste product. You know, in the hospital, after the doctor has maybe suspected a disease, you have to be sent to the lab. And the laboratory scientists, they have many things to use to maybe run some tests according to what the doctor has prescribed. And so after that, there usually a lot of waste that if not taken care of, even staff will become sick. Workers who are in
I think there's a problem with the internet.
Yeah.
So let's just give it a while for him to reconnect. I think there's really a problem with the network.
Yes, Cameroon network.
Okay, I guess he's trying to reconnect. So let's just be patient, please, while we wait for him to reconnect. Oh, okay. While we are still waiting, I just once more I want to welcome Justice Law for joining today's webinar. So, Justice, where are you joining us from?
The mic is mute.
Justice Law, where are you joining us from? We also have Angela. Yes, who just joined.
Yeah.
Okay. All right, Justice Law.
Thank
Okay.
you.
Okay. Yeah. Thank you.
Thank you very much. I'm joining people from Bafusam.
Okay. Oh, Bafusam, Cameroon. Okay. You're very much welcome. Thank you for joining our webinar today. Oh, sorry, I think we're having a problem with the internet because Dr. Valerie is joining us from Bamenda, Cameroon. So I think there's probably a difficulty, a problem with the network over there. So please let's just be patient while waiting for him to reconnect. I think he's trying to reconnect. Okay, so thank you for joining us from Bafusam. And then we have Angela. You're welcome. Hello, Angela. Could we hear from you? Where are you joining us from? Hello, Angela. Sorry, I don't know if you're saying something, but we can't hear you because your mic is on mute. So you're probably saying something. So if you are, then I'm sorry, but we can't hear you. Okay, I think it's also a problem with the network. Let's see. Yeah, I think maybe I don't know what is happening with the internet today, because also Miss Ashimaja also had some issues with her network. So, and now it's also happening in Cameroon. So I don't know what's happening today. Okay.
I'm so sorry. My network just cut off like that. I'm so sorry.
No problem.
It's understood. It's understood.
I'm so sorry. My network just cut off like that. We are messed up a lot. Okay. So I was talking about the microbiology waste, and I think I was done with the third category of biomedical waste. Okay. Now we have a category, we just call them general waste. As you can see on the slide, you have things that include food waste, office paper, plastics, cans, glasses, meals, and others. This is usually separated just for the sake of uh, being well disposed, or which one has to be incinerated and which one has to be sent to the municipal authorities. We are going to see how the situation in Cameroon is handled. All right. This is an area where we don't take it lightly, especially in the hospital settings, to separate all sharps and things like hypodermic syringes and needles, intravenous needles, ampoules, vials without content, lancet, and others. These are things that are potentially contagious. When Mrs. Ashima was talking about infectious diseases, this is where the problem usually arises. Those who are in charge of disposing them, most often they are incompetent. They don't know certain universal and standard precautions, and so they end up contaminating themselves. And sometimes even they are not even well protected themselves. The gloves that they wear can easily be pricked by these needles, and so they are separated into sharps because you have safety boxes where these needles have to be put inside, just to reduce the risks of the workers, the health staff, the nurses, whoever is at the expense of these things, so that they should not get infected or they should not become sick at the end of the day. Then we have the chemical and pharmaceutical waste. This includes all materials like cytotoxic drugs, discarded medicines. You have waste with toxic chemicals, things like broken thermometers, battery, fluorescent herbs, and others. You these ones are separated too because it's easier to get rid of them when you put them in categories like this. So briefly, that's how we can group the biomedical waste. I hope I'm audible.
Yes, you are.
All right, so we'll go to the next slide. Okay. So we'll go to the next, the last one, which is radioactive waste. Usually is a branch of medicine that we call nuclear medicine, where we use radioactive materials like gallium, thallium to do a diagnosis, to do imaging. Sometimes we use it for treatment and use it for different medical interventions and research work. after this, the waste, and it could take most of that 10, 15 years. There are certain cancers that have been linked to this radioactive waste. So care must be taken to make sure that they are properly disposed of. So we classify them under radioactive waste. Can we go to the last category?
Yeah.
Yes. Oh yeah.
Please, can you help me change
Different
this slide? Okay.
different
So
methods of
there are different methods of biomedical waste management. Biomedical waste management. So on a global scale, we have different methods of biomedical management. So generally stated on this slide is what we'll find even in developed countries. Methods like microwaving, mechanical and chemical disinfection, incineration, which has to do with controlled burning of waste products. We have autoclaving, we have deposition into landfills. We are going to see in detail how it is done here in Cameroon. And then putting them in pits. So these are general methods by which we use to manage biomedical waste on a global scale. Okay, so in my country, which is Cameroon, often called Africa in miniature, there is this law that was passed in 1996. It's called the Framework Health Law. This law was passed, and one of its objectives was to regulate waste management. Unfortunately, it took 10 years for the Minister of Public Health, who is the highest authority in Cameroon, where policies are made, adopted, and then implemented at the level of the regions. So in April 2006, that was 10 years after this law was created, and under the Ministry of Public Health, the Hygiene and Sanitary Unit was created, and it was made to be made an integral part of every public health facility and hospital in Cameroon. It was to be the main body that will be responsible for the implementation of and regulation of healthcare facilities. And one of it was to make sure that the proper hygiene and that there's proper waste management. But unfortunately, it has not really yielded much fruit because of the consequences. What was being seen in many health workers in Cameroon, after a long time working in hospital, they became victims of infectious diseases, HIV. You have common things like hepatitis B that can be transmitted by blood and all those needles. So this law was enacted to reduce these risks and to also save the lives of many workers, those that have access to these waste materials, those who are in charge of getting rid of them to make sure that they are safe. But it has not really yielded much fruit so far. So like I said, the unit has not done much as far as biomedical waste management is concerned. It can still be well stated that there is a total lack of a unit algorithm in managing the biomedical waste in the country. We don't yet really have, the ministry has not yet adopted, there's no particular policy to really state with from the brief study that has been done. Basically, different regions just adopt what is best for them according to what they have, their equipment they have, and their expertise. And most often, we always run into a lot of trouble. So, but for now, there's work that's being done, and we are hoping that in the nearest future, we will have a unique way that we know that a policy has been made and that there are certain rules that people must obey, because people tend to behave better when they know that there are eyes on them. So we are looking up a lot upon the Ministry of Public Health to help us through this hygiene and sanitary unit for things to get better. Please, the next slide. Though the principles are adopted at national level, like I said, most equally are used by many countries. So we only adopted it for our country. Some studies have been done in Cameroon on biomedical waste management at the Kumbo Health District, that's in the Northwest region. Bamenda Health District include the regional hospital. We also have a study that was done in Biamasi, that was in the Northwest, the Central region. We equally had a study that was done on biomedical waste management at the Marwadisi Hospital and one at the Southwest region. And what was noticed is that many of them adopted the certain principles that are used nationwide and even international in managing biomedical waste. To the next slide. Okay. So in Cameroon, for example, this now is a practical thing that is done, especially at the local, regionals, the general hospital, teaching and reference hospitals. At each health facility and district, usually the resources are identified, and this is for safe and practical biomedical waste collection, handling, and transport. Why I'm saying handling and transport is because managing biomedical waste in Cameroon is not just by health workers. The council has a lot to do. Because most often the hospital don't have enough space and land. So we have a company here called Izakam, and so the hospital work hand in gloves with these municipal authorities. When the waste have been prepared and kept, they will come and carry it through their vans, and then they will go and deposit them in the places where we are going to see. So for this management to be done properly, there are certain principles that have been adopted and they are really well practiced. I thought I should mention them there. There are 5 main principles that we talk about. We have what we call minimization of waste. So usually at the hospital level, the authorities encourage health staff and doctors to reduce unnecessary injections to protect healthcare providers and the public from unnecessary risk. As you can see on the slide there, the picture. Then we equally have this principle of segregation of waste. Like you saw, we already classify waste into sharps. This is very, very, very important. When you separate it into sharps, infectious waste, non-infectious waste, people become more careful and they know the dangers that are associated. You can see the yellow safety box there. All syringes, all needles have to be emptied immediately you do an injection. If you are a nurse or you are a medical practitioner, whoever is administering a medication or an intervention to a patient, you have to immediately drop the sharps into the safety box. This is very, very important to reduce what we call hospital-acquired infection. Usually, in fact, in the developing country, which my country, Cameroon, is one of them, our problem is still infectious disease. Even with the advent of antibiotics, we still have problems with things like tuberculosis, we still have problems with HIV, we still have problems with hepatitis, we are still struggling with malaria, we are still struggling with diseases like typhoid fever. So all these principles are used to reduce the risk of transmission of diseases and to reduce the risk at which workers themselves who are in charge of getting rid of all these waste products, they themselves do not become sick at the end of it. Please, next slide. The third principle is self-handling of sharps. Like I said, immediately after an intravenous injection or intramuscular injection, you have to drop every sharp, uncap the needle as the nurses are trained into the safety box. So safe handling is very, very, very important. So the use of puncture-proof safety boxes or needle removers for disposal of all needles and plastic syringes are medical sharps that are done. And in fact, this is an important principle that most often when the nurses are brought to hospital, they are first of all trained on this very well before they are allowed to handle these materials. The next principle, we have safe collection of medical waste. And we apply segregation and handling procedures to all healthcare delivery areas. It doesn't matter what is being done. Waste handler must use all personal protective equipment, especially with the era of COVID-19, like Mrs. Ashima already spoke a lot about. So people are more careful. The staffs are well trained and cautioned concerning these materials. So it is a routine way and it is done all the time before collection and even during transport. And we equally have the safe final disposal, which we use the best available destruction option for final disposal. We are going to see the various methods of management in the slides ahead. Please, next slide. Okay. So in Cameroon, we have different methods, as I already made mention. We we still have a lot to do as far as our country is concerned. It's a general problem for the developing world. like I said already, we don't have a unique algorithm in managing biomedical waste. There's a general lack of a common algorithm, but through the health and sanitary unit, like I mentioned, to see how we as their slides. The next slide.
Wow.
The network.
Yeah, I think the network is really terrible today. So let's be patient and wait for him to connect.
All right. So, like we see in this slide, management of biomedical waste in Cameroon is not the work of one person. There are many hands that come together to make sure that the waste they are properly disposed of. The municipal authorities are involved, who are in charge of even gathering the waste just within the hospital, even carers, patients themselves, they are not left out. And this is to ensure that the public workers and all health staffs are not exposed to biomedical waste unnecessarily. Because, like I said already, if you want to see in the past, developing countries, even after antibiotics were introduced, our problem has always been infectious diseases. And how do this come about? We dispose of waste anyhow. There's no particular way of people getting rid of their waste. You see, somebody will just carry things from the bucket and just go and deposit in a river. And down the stream, there are some people carrying water from that same river and they are drinking. And these wastes, you see, uh, these are things that carry potential microorganisms like bacteria, fungi. In the long run, we have issues with diarrhea, we have issues with typhoid fever, we have issues with, tummy aches, and most often they are infectious diseases, things that would have been prevented with proper hygiene and sanitation. So this is why waste management is being taken very, very serious. Though most health centers and this hospital do not really have the necessary equipment and technology, sometimes it is usually a lack of expertise. Like most hospitals have incinerators, but you will discover that it is not well managed even. You don't even have a good technician to manage the machine. And so sometimes when they get bad, repair is even a problem. But we are really trying our best. Please, next slide. All right. So the first method of waste management, I think one of the most common method, especially that's applied at district hospitals in Cameroon, is incineration. As you can see, it is very, very common. It consists of putting waste in a machine, and that machine is known as an incinerator. Then you burn it into ashes. The problem here, like Ms. Ashima already made mention, it was one of the hazards is air pollution. If you see the middle picture, when you burn, there is no way to stop that gas from going into the atmosphere. And the consequence is that when you burn and this process called combustion, you release toxic gases into the atmosphere, sulfur dioxide, nitrogen dioxide. These gases, for those who do geography, say they deplete the ozone layer. Some of them are potentially carcinogenic. When they are released into the atmosphere, we inhale them. Some of them we become in contact through our skin. In the long run, we suffer things like cancer. Unfortunately, in the developing world, we are having problems now with cancer. And one of the problems is poor management of this waste. Incineration is successful in, getting rid of waste, but it is really a source of hazard to the atmosphere, to the human health. It is quick, It is easy and simple to use. The disadvantage goes beyond air pollution. This is just what is done in Cameroon, just similar to what is done in Burundi and Nigeria. So that's an incinerator that you see there. And you see that pipe that goes to the atmosphere, all the way that is burnt. Every gas is released through that pipe to the atmosphere. Everywhere is contaminated. Sometimes when this gas is released, everywhere becomes dark. It is just really bad. But it's one of the most successful methods as of now in my country. Please, next slide. And the second method of waste management in Cameroon, this also is very common, is dumping into landfills. Landfills are simply large surface of land, usually for hospitals that don't have space. In Cameroon, is level at the level of the districts and some regional hospitals. What they do is that when they gather this way, they put them into cans and they put them in front of the hospital. Then they will call the municipal authorities. We have a company here in Cameroon, especially in the Northwest region, it's called Ayazakam. They will come and gather these waste. They will transport them using standard precautions. They have special gloves, they wear equipment to protect themselves, and they will carry them to these landfills and they'll dump them there. Most often, the landfills even are full and they will have to gather it and still burn. And during this burning, it is a whole lot of trouble. The surrounding is just polluted. But usually, it is a land that is far away from human habitation. And so, it can take 3 to 4 days even to burn just to free the land and for them to continue dumping them there. And the hospitals usually, when sometimes they will even prepare the waste and keep, and they will not be available. Sometimes they will complain of fuel problems, but it is also one of the successful ways uh, that has been used and is still being very used much in Cameroon. Please, next slide. Please, can you take me to the next slide? All right. Burial pits and toilets. Truth about sometimes there are vans that are kept at junctions, especially in places like Northwest, Southwest. What the vans have been kept there by municipal authorities so that people can carry these waste from their homes and bring them and dump them there at the. They are usually kept at main junctions, but unfortunately, these individuals, some people will not bring them. They will carry these waste and dump them in waters. Like I said, these are potential sources of infectious diseases. So people instead dig pits around their houses and they are putting their own dirt in their own houses and that they are making what we call compost manure. Some put them in their toilets. So even some local health centers do this. They put dirt in the toilet. Some hospitals will dig pits themselves, especially behind, and they will be depositing this waste, especially the hospitals who cannot afford the incinerators. And most often, it is really a problem because it will start smelling, the whole environment will be toxic, and these are potential sources of breeding grounds for mosquitoes. Africa is an endemic region for malaria, and this is one of the reasons. We dump dirt, we keep them, and they become shady areas, and they encourage a lot of mosquitoes. And very soon, people will be sick. So people just drop this waste into the burial pits and toilets and so on. Some they don't even have gloves. They don't even have nothing. They don't protect themselves in any way. So they themselves become sick after a while, not knowing that it is because of the poor waste management. As you can see on that picture, that's what is practically done almost always, especially in the health centers in my country. Please, next slide. Open dumps. In fact, this is so common. On that picture, and you saw what Mrs. Ashima showed in India, it is the same thing in Cameroon. It is fond of this. Even in some local health centers, you can see this. They just dump the dirt. They just carry and throw. Sometimes you see dogs fighting over, abandoned food. You see goats. You see animals who come there in the night to, also eat from there because everything is just so open. And most often, the hospitals who do this is a savage means. savage because they don't have an incinerator, for example, to burn this dirt. Their toilets maybe are almost full, and they see it as the only way to get rid of waste. And so they just dump it in the open. And sometimes the municipal authorities will have to come and carry after a while. They stink a lot. They are breeding grounds for mosquitoes. They attract flies. So people with filaria sometimes are just because of the way in which these wastes are managed. Please, next slide. And hospital home disposers. Cameroon being Cameroon and being part of Africa, we are people with tradition. We have beliefs, norms, and cultures. Sometimes, even when patients are leaving the hospital, they carry certain things that belong to them. They will not allow the hospital themselves to dump it. It is in line with their culture. They believe in the culture and they want to respect their culture. It is very common to see women that put to bed and they want to carry their placentas back home. You see children who are in hospital that are newborn babies. After their nerves fall, they will carry themselves that they will go and bury home and so on and so forth. You see people with amputated limbs, maybe a diabetic that has a limb that is dead and he undergoes an amputation, they cut the leg. The family will want to take it and go and bury. Sometimes they might go and eat those things. It is tradition. They believe that it is part of them, and therefore there's no reason why they should be alive, why part of them is buried to the ground. And so, most often, sometimes as ugly as it may appear, but it is very, very done in my country, Cameroon. Some women even eat their placentas. It is some women even eat their placentas. When they put to bed, they fight over it. They believe that it helps them to bond well with their babies. So they use this as also means of disposal. In hospitals, too, we also have things like placenta pits, but these women will not allow the hospital staff to get rid of this placenta through the pits. So sometimes you just have to allow them, since you cannot destroy their culture and you cannot forcefully withhold this placenta, nerves, and amputated limbs or human parts. You just have to give it to them to place them. Please, next slide. Yeah. Autoclaving is not often done here. Most often it is done in my country, but it is done to sterilize medical equipment, especially before a surgical intervention. They undergo autoclaving. Autoclaving one of those successful sterilization methods because there are certain germs, like the germ that causes tetanus, Clostridium tetani, even up to 121 degrees of temperature, that germ can still survive. But autoclaving, the temperature goes above 121 degrees, so it can destroy those powerful germs. But most often, as a means of biomedical waste management, they are usually at the teaching hospitals and reference hospitals that this can be done, but it's hardly done in our country. And we have mechanical and chemical disinfection. It is commonly done, especially at the level of the local health facilities. Please, next slide. Yeah. Microwaving. Microwaving, most often in my country, is not really used as a means of waste management, but in other countries like Nigeria, they do it. Nigeria, you have countries like Ghana, but in my country, it is still a far-fetched. First of all, because maybe affordability is a problem. So most often with microwaving, those people use it for food preservation and others, but as a form of waste management, it is still a dream for my country. All right, please, next slide. All right. So in general, as far as my country is concerned, those are the various methods of biomedical waste management. I want to say that the hygiene and the hygiene and sanitary unit of the Ministry of Public Health has a lot to do as far as policy on biomedical waste management is concerned. But so far, we are not doing bad, and we can only hope for the better. And we know that it will only happen when many hands come together. It is really a personal belief that I have that in the nearest future, we are going to get rid of our waste better. We are going to protect ourselves. Cancer today is becoming a very common disease. Leukemia is becoming a very common disease. And one of the things in leukemia that cannot be explained is environmental toxins. And these things, sometimes these waste product, radioactive waste, as I mentioned, these are things that when our bodies come in contact with time, they change the way our cells function. They alter the genetic makeup of our bodies. And in the long run, we become sick. These things that we burn, the materials we burn through incineration, when these gases are released into the atmosphere, we no longer have control over them. We inhale them. We come in contact with them through our skin. With time, they change the way our cells function. That is how cancer comes about. Most at times, especially during the rainy season, you see epidemics of cholera, especially in the far north of my country, especially in the north, because you see people carry their waste and dump them uphill while others are down, fetching water from the same source because there's no proper policy. People are not afraid to carry waste and dump them in rivers because we still lack a policy. But we believe that in the long run, it will be better in our country. And we think that in the nearest future, at least the story will change. So thank you very much for listening. All right, I'm done. Sorry for my breakage. My network was really troublesome.
Okay. Well, thank you so much, Dr. Valerie, for your wonderful presentation. It was really, really great. It was a journey, really a journey to learn about the biomedical waste management in Cameroon. You've said it all, and there is a lot to do in order to set things right. So, all right. So I think now the floor is open for questions or comments from the audience. Yes. So please, any questions or comments regarding the presentation?
I would like to comment something.
Okay.
I would like to thank Dr. Valerie
All right.
for such a good critical insight about the topic and all the medical terminologies, because a lot of people don't know the terms and that is why they cannot relate with it. However, the problem is something very practical and everybody knows it is around. So thank you so much for this clarity, Dr. Valerie, and it was very relatable in Indian perspective as well, especially the concerns of landfilling and open burning, incineration. So that is something that gives me a broader picture about the ground reality of a lot of countries which we are facing, and together devising solutions in order to tackle that. Thank you so much.
You're welcome. You're welcome.
Thank you for your comments, Ashimaja. Thank you. Okay, any other comments or questions? Your mic is mute. Madam Awambe, you're trying to say something that your mic is mute.
Yes. Okay. Is it okay now?
Yes.
Yeah. Okay. No,
Yes, I
I
think I
just
can hear.
want to thank Dr. Valerie. In short, I am really full of it because I know my country, Cameroon. I'm from Cameroon to have a lot of things to do. So as I'm here like this, I'm just like, how can we do, because I've really, it has really touched me, because I really know my country. We really have a lot. I just thank for this meeting today. I just thank you people, and you are so wonderful. There are things like this that we should think now, how can we do, because we have a lot of work to do,
Yeah.
So I'm just like, how can we just start to do things now like this, because I'm really, I'm short of word, but I say thank you very much, Dr. Valerie. Uh, thank you both so much. It was wonderful.
You're welcome, Miss. You're welcome.
Okay. Thank you so much, Mrs. Awambeng, for your comments. We really appreciate that. Thank you so much. Okay, any other comments or questions? Okay, so while waiting for for any questions I would like to ask a question. Something you said which really surprised me. I never knew. You mentioned that
Okay.
in some cases, some women or some people consume maybe part of their body that
Yes.
was cut off or
Mm.
placenta or something. Is that really
Yes.
happening? Because I'm really surprised.
Yes.
Wow.
It is happening, and in fact, medically, it has been proven even that in some women, after they have given birth, they suffer from depression, and their placentas, when they eat them, it has been shown to cure postpartum depression. And so, some women, when they put to bed, they eat their placentas. It is done not only in Cameroon, in other parts of the world. It
Wow.
I thought
happens.
that skills now.
Wow.
Mhm.
Wow. This is
Sorry,
really,
madam, I didn't get you.
No, I think that they say it's something like poison. That way, if you eat a placenta, you will die, something like this. But I'm surprised to hear today that people
Well,
eat
that's
it.
tradition.
Oh my God.
That's
Mm.
tradition, or it's tradition, but there's nothing there that is toxic that can kill you.
Oh, my God.
Uh,
Mm.
yeah, it's shocking. It's really shocking. I've never, yeah, it's really, it's shocking. Like, I just can't believe this is actually happening. So, wow. Okay. All right. Okay. Another thing about the technology, you talked about microwaving. How is it different from the normal microwaving of food? How is it different? I don't know if you could better explain, like, to a layman like me.
Maybe the network. Yes.
Yeah, I think so. Okay. It just gives a while for him to connect. Okay. While waiting for him to reconnect, we have a message from Angela, and she says she's joining from the Philippines, and she's here, to also gain some knowledge on the biomedical ways, and yeah. So thank you so much, Angela, for joining our, our webinar today. If you have any questions or comments regarding the presentation, please, you're
I'm
free.
sorry, I didn't break in my network.
Yeah, it's understood.
Uh,
Mm-hmm.
Actually, I've not seen the technology.
Okay. It's really a big problem with the internet. Yeah. I guess in one of our webinars, we should talk about the internet crisis in Africa, because it's really a big concern. Okay. I think he's struggling to reconnect. Yeah, he should better because I have more questions for him. Okay, so while waiting for Dr. Valerie to reconnect, yeah, I just want to talk a little bit about the two presentations. As we've seen, I believe, like both countries have, very similarities in terms of the management of biomedical waste. Of course, as Ms. Ashima Ja earlier mentioned, so the issue of emissions from incinerating biomedical waste and things like that is causing a lot of environmental and health concerns. And, it's one of the root causes for cancer. So it's really a huge problem. And yeah, and also Dr. Valerie mentioned the issue of cholera, especially in the northern part of Cameroon, where people dump waste upstream while there are other people downstream who are fetching water. So cholera is really a huge concern. And still, sometimes it just, I just wonder, because we do these things and we realize that, it's actually affecting us, affecting our health, yet we still keep doing it. That is why, as Ms. Ashimaja earlier mentioned, we need the rule of law to really push people, because though some people will see this as dangerous, yet they still indulge into, such practices, So some people don't really pay much attention, which is really a problem, because if you're dumping waste upstream and then you fetch water downstream, I mean, how do you want to come out of this? It's really, really, yeah, it's really, really a problem. It's really an issue. So I believe it's in as much as we're trying to create more awareness, there's a need for a rule of law, and of course, proper waste collection, segregation, collection, and recycling is very, 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 very important. Because also, if waste is not collected, people will look for various means of disposing their waste, like we saw the open pits, and also dumping into pit toilets and things like that. So it's really, really a huge concern. Yes, because like in Cameroon, I believe it's not only a problem in Cameroon, but other developing countries. It could be the same situation in India. Not all waste are collected. We have a main collector, that is Hizakam, but still, just a portion of the waste is collected. A bulk of it is still uncollected, and this is just litters. It just littered around the environment, around houses, drainage systems, and things like that, and it's really a huge concern. So the waste has to be collected, and for us to promote recycling, there's need to segregate or to separate the waste into various types so that recycling could be fostered. So I think that's something that is really lacking in developing countries, because I believe developed countries have really advanced in terms of waste segregation and collection. So all right, so thank you so much, Dr. Valerie, for we're happy to have you back. So thanks for reconnecting.
Yeah.
Yes, so you were
Network
saying
issues.
yeah. And we are sorry about the network issue for those of us who are joining us live on Facebook. So yes. Okay, so please proceed. You're talking about microwaving technology. Yes, Dr. Valerie.
I didn't get you.
No, you were saying something. You were talking about the microwaving.
So the idea of microwaving,
Mm-hmm.
the idea of microwaving of waste is not really a means of managing or getting rid of it. It is meant to reduce the toxicity of that waste before disposal.
Okay.
Just like when you put food in a microwave, maybe to
Mm-hmm.
warm it or something. Yes. There are certain ways that carry a lot of toxicity. So when you
Mm-hmm.
microwave before you incinerate, for example, since because once the gas that you have produced through the incinerator, you have no control over the gas again. The
Mm-hmm.
microwaving is just to reduce the toxic nature of that waste material before you can choose maybe to dump it at a landfill or an open dump in a pit or before you incinerate in the machine.
Mm-hmm. Okay. Okay. All right. All right. It's understood now. Okay. Thank you. I have another question.
All right.
About the collection, like at the hospital level, if you separate, the various
Okay.
waste types, right? And you say this is toxic, non-toxic. At the end of the day, ISACAM, the collection company, still comes and collects everything together. I don't know what difference it really makes if we separate them and then yet still one collector comes and bundles everything together and takes it to or takes them to the landfill or you know or for incineration or something like that. What is really the
Okay.
difference? Yeah.
All right. The idea of separation is first to protect the person who is in contact before the waste reaches even outside for those from the municipal authorities to come and collect. If, for example, a nurse uses a syringe or the head is very contaminated at that time, maybe on a patient that is sick of HIV, a patient that has hepatitis. So separation first makes the person who is separating to be aware of the danger of what he or she is having at his disposal. That is the first thing that's the first idea is to raise an awareness to the worker that he should know how contagious what he's having in his hand. That's the first thing. Then also when you take those sharps now and when you look at the how do you call it again? Where we empty the sharp, the safety box, you
Mm-hmm.
notice that even the collection container is different. The safety box is different from maybe a general can where you can throw gloves inside. So it is more protective to the person who is handling the waste. That's why the separation is important.
Okay, I see. So when his account collects, do they really pay like much attention on the infectious waste? Because from my experience or seeing what they do, because the waste usually are put in buckets, right? And then they just come, collect, and just pour into their truck. So it's not like they are in plastic bags or protected bags. They just put everything together and they go and dump. So yeah, so that's what I was wondering. Of course, the people at the medical center, the health center, they have more awareness that
But
this is
sometimes
infectious. Yeah.
I was saying that sometimes when the kind of gloves that they have, what we just do for them is to alert them to know that what they are handling is potentially contagious and that handling it wrongly might end your own health in danger. So usually they have special gloves that they wear, special boots to make sure that a syringe does not drop on their feet or that they don't get pricked by a needle. But sometimes they will still just be careless. But what we do is we educate them on the dangers of what they are handling. And also it will be at the individual level now to say that, okay, I myself, I want to be healthy and I want to take care of myself. And I know that handling this waste can become a health hazard for me. And the people too, learn to be careful. Generally, that's just what is done.
Okay. All right. Thank you so much for clarifying that. Thank you. So any other questions or comments? Do you have any other questions or comments? I'm not very much versed with, like the health system or the management of biomedical waste in various countries. But I don't know if Dr. Valerie, this question goes to you. I don't know if you have any information or knowledge on the way other countries recycle their biomedical waste, because I think it has to go through a thorough process, not because like the waste contains metals, right? Like the needles, and then also you have plastic materials and things like that. So I believe there's a special way of handling this waste before recycling, before the actual recycling. Like plastic waste in other countries, they're used to generate energy, and they all recycled into other products. Oh, yeah. So I don't know if you have any knowledge on how other countries actually recycle the biomedical waste. After collection, how do they recycle the waste? Any ideas or any knowledge or information on how it is done in any country?
Well, actually, I'm not very versed with the different recycling methods. And one of the things that really discouraged me is, first of all, because it's not really done in my country, so I'm not happy. But what I do know as far as recycling is concerned is that most often, actually, the waste, like we said, there are certain principles for management, like separation of the waste. It is not everything that is even recycled. There are some things that are just burnt. Another, they separate the waste and they use what they want to use, and it passes through a sequence of complex steps. I'm not there, I don't know the details, for them to produce energy or whatever. In our country, Cameroon, the only thing that I know as waste that we recycle here is we use physics. I used to hear that there's local gas, especially here in Bamenda, they use physics to recycle and they make local gas, but I don't know the details in other countries. I don't really know.
Okay. Oh, okay. All right. Thank you. Because I believe, like as health practitioners, I think we should really have the concern, like apart from collecting the waste, what happens, because we are not only looking after the people we are treating at the moment, but how are we taking care of people who will potentially fall sick? So I believe yes, like you said, the Ministry of Health is in charge of making the overall policies on that. So I believe they should not only look at the collection or the segregation and collection of medical waste, but how are these wastes recycled or how are they managed? Because if we only want to incinerate, we are talking about air pollution and things like that. So what is the end life of this waste that is collected? What do we do with the medical waste? What do we actually do? So I believe that is something that should be critically looked into. Like,
The
of
point
course,
of concern for me.
yeah, because of course, like we're saying, it's not only a problem with medical waste, other waste as well. If we segregate or we separate the waste, we collect them. What do we do? If we don't recycle them, then there is still a problem. It means the segregation, first of all, it wasn't really,
has no use.
yeah, it has no use. It has no use. So if we are encouraging the masses to separate waste, then we need to also encourage recyclers, like give room for people who want to start up like recycling businesses or set up like public plans I'm saying public plans, like the government of the country set up, big heavy plans to recycle a bulk of this waste, while small businesses could be thriving, to recycle other waste. Of course, like now in Cameroon, we have like metal recyclers and and those small businesses are actually thriving. But I think there is a lot that has to be done, because a bulk of the waste that is collected, not only a problem in Cameroon, but other countries, a bulk of the waste that is collected is sent to like the landfills, and when they, when landfills, and after a while they do open burning, and this is, like you earlier mentioned, is the gas that is released, the CO2, all those things are depleting the ozone layer, and this is the whole problem. We're talking about climate change, global warming, and of course our health, so our direct health, so cancer and all of that when we inhale all these toxic gases and things like that. So it's not really helping us. So as we are segregating and collecting the waste, we should also try as much as possible to recycle the waste, and most especially biomedical waste needs to be handled properly. So basically that is a wrap up of the presentation today. And yeah, so I really appreciate our two speakers today, Dr. Archie Valerie and Miss Ashima, for your presentations and for bringing us, because I believe you guys are the one who really brought us together to sit down and talk about this type of waste, which I believe, from my knowledge or experience, is not frequently spoken of. So I think it's a call for concern, or is a awakening call for us all to see that this is something that is going on, and there is something that needs to be done to address the situation. So thank you all so much. Of course, to others who join us, we have Justice Law, and we have Angela, we have Azongazi Collins. Yes, I don't know where you're joining us from. I think I don't know, Azongazi Collins, are you there? Could you say a word? Or where are you joining us from? Are you there? Okay, Angela, you're here. Yeah, Angela, could we hear from you? I don't know what you think about your presentation today, or the talks about biomedical waste management. Yeah, could we hear from you, Angela?
The mic is mute.
Nice.
Yeah.
Hello. I just want to say nice. Wow. Because yeah, I learned so much that I cannot learn here in Philippines. So thank you so much, Dr. Valerie. And, nice to meet you all, and thank you so much for this opportunity that you've given to me. And again, I learned so much about biomedical waste management. And thank you.
Okay, thank you so much, Angela. Thank you. And by the way, Angela, as Ella mentioned, she's joining us from the Philippines. So thank you so much for attending our webinar today. And yeah, we're happy that you're able to learn something. I hope in the future we'll also be happy to learn about the situation in the Philippines. So thank you very much. And Justice Law, would you like to say a word before? And okay, Archie Valerie. Okay, your hand is up. Dr. Archie Valerie, your hand is up. Yes.
Yeah, I just wanted to say that Asongazi colleague is actually a doctor too. He's my colleague. So
okay.
I invited him to the platform. Yeah.
Okay. All right. Thank you. Thank you, Dr. Asongazi Collins, for joining to webinar today. Thank you. Of course, we'll be happy to hear from you, at least a word from the other doctor in the house. So thank you. Yes, Justice Law, please.
Yeah, I learned a lot about how to mitigate chemical waste. But there's an issue in Cameroon.
Mm-hmm.
The government of Cameroon is not. I want the doctor to really to advise the government, because normally there's no properly mitigation of biochemical waste in Cameroon, because in fact where they even burn the waste, it affect the citizens of the country. So I wish that they should come out with a campaign in order to improve the mitigation of biochemical waste in Cameroon. Because for so far, let's say example, in our town Bafusam, the waste is even exist where they need to mitigate it. Thank you.
All right.
Okay, thank you so much, Justice Law. Thank you. So our doctors, would you like to say a word with regards to that?
Hello, everybody. I don't know what you know.
Yeah, hello, Dr. Azongati Collins, you're welcome. Hello, your mic is mute.
So, oh,
Yeah. Yes. Oh, yeah. Your mic is mute. Your mic is mute. Okay.
I think I've unmuted. Am I audible enough?
Yeah.
Yes, I can get you.
Okay.
I can get you.
I was trying to say, I enjoy the way our host struggles to call my name.
Yeah. Totally. Yeah, I'm sorry about that. Yeah.
I'm very, 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 very happy to be part of this forum. It is rather so unfortunate that I'm so late because I was caught up something. Then when I realized, because I didn't know the actual time for this Zoom meeting, it is something that I love in person to see, young people like myself who are out there coming up with powerful points, to try to move the society forward. This is something so great, and it is something that we all need this knowledge. It is just a pity that we are just so few people are participating. But nevertheless, that should not break down our courage. I want to really, really appreciate the presenters. From the little I got, it was really wonderful. It is so, even it can be something that we see day to day, but to come up with an analysis and trying to see how we can do to prevent harm or to even make resources out of this waste. It is something very important. I will just want to thank the presenters. I want to encourage them, and I want to say that please, next time if there is something like this in the background, please people should involve me. Let me do my own presentation.
Yeah, that would be great. That would be great.
Yeah, I'm serious about it. I'm serious about it.
Part one. This is part one of this. We have to talk more about this. So this is the first part of this. Yeah, of this topic. So, Dr. Valerie, just hold him tight. We are waiting to hear from Dr. Azongati Collins.
He's my man. He's my man. We are together. Don't worry. He's my man.
Okay. All right.
Okay, I don't want to talk much. I've spoken. I just want to greet everybody, and I say that no, it was really an educative forum. We just only hope that what we've said here, we can be able to transform it into action, and even we all will benefit and help the society. Thank you very much. More and more of these type of gatherings and meetings for a better society. Thank you.
Thank you so much, Doctor. Thank you. We appreciate you joining, even if it's just for a few minutes. We just appreciate your being here and, commenting on the presentations and encouraging us. So thank you very much. Thank you. Yeah. And as like Justice Law said, I think there's so much that has to be done because, of course, we begin by talking, and then what should we
Yes.
do? What action should we take? So I believe this is the first step of the whole journey. So it's for us to create more awareness, and even as what Miss Ashimaja is doing in India, creating more awareness, and then trying to carry out projects for people to see like this is actually what can be done, you know. So this is the first step to the journey. So let's just keep working hard. Yes. So yeah. So that is it. Okay. So do we hear from you, Miss Ashima, once more before we? I don't know if there's something you would like to say before we call.
I would just wanna say in the very end that it was a wonderful discussion and very constructive discussion and pointers that come in place. And I think we have achieved the first step, that is all the youths together and discussing about it. So we have achieved the first step of recognizing the problem. So now we know what our concerns is, and I think the best way is to carry out small projects, maybe through Facebook or maybe through online channel, and give away awards so that more people are attracted, and that is a best way to target more people into this discussion and this group. So that is all we can start off with, and all the very best. I really look forward to in working with all of you in near future.
Well, thank you. Thank you so much. We look forward to working with you too. Thank you. It was really great to have you on board, and thank you all for your time and for being for being there, for accepting to be on this platform to talk about this problem, which is biomedical waste, how to manage the biomedical waste or how it is managed in other countries. So thank you all so much. It was a wonderful time, and thank you to Dr. Valerie. I know the internet was a bit of a problem, but thank you for your efforts to try and reconnect as much as possible. And also thank you, Mrs. Awambeng, for being there too. She's a member of our foundation. So thank you so much, Ms. Awambeng, for being there and for your comments and contributions. So I believe if there's nothing else to say, I think verily we've exhausted what we plan on discussing this part one of the webinar, and we look forward to part two. And yeah, we are excited that Dr. Azongazi Collins will be able to brace us with his speech on biomedical waste management. So thank you all so much for joining, and I wish you all a nice time, and let's keep talking and let's keep working to make change in our environment, in our lives. So thank you all so much, and have a nice day. Miss Ashima in India, Miss Angela, have a nice day in the Philippines, and for Mr. Justice, Dr. Valerie, and Collins, who are joining from Cameroon, have a nice day, and Mrs. Awambeng, have a nice day in France. So thank you all so much, and yeah. So this webinar is actually live streaming on Facebook, so you could follow us on our page, and also share the link with others. So yeah, so to spread the word for others to also understand what is actually going on. So thank you all so much, and I'll see you in our next series, our next webinar series. Thank you and have a nice day. Thank you. Bye-bye.
Bye.
Bye.
Bye-bye. Thank you.
Bye.
All right.
Thank
Bye.
So
you.
much. Bye bye, everyone. Bye bye.
Thank you.
And